Good morning, everyone. Welcome to the National Cancer Policy Forum. My name is Mike Caligiuri. I'm the CEO of the James Cancer Hospital and Director of the Cancer Center at The Ohio State University, and it's a pleasure to have each and every one of you here today. I'm chair of the National Cancer Policy Forum. I want to give you just a little brief introduction about the forum and then introduce today's speakers. So the Institute of Medicine, now the National Academy of Medicine, established the National Cancer Policy Forum to serve as a focal point and trusted venue for the engagement of national leaders from multiple sectors, working collaboratively to address high-priority policy issues in the nation's effort to combat cancer. The Academy draws upon its unique independent status and expertise to steward sustained discussion and collaboration among national experts with health stakeholders on issues relevant to the goals of preventing and treating cancer. Participants include clinicians, patients, researchers, professional and advocacy organizations, pharmaceutical manufacturers, and policymakers. The objectives of the forum are to identify emerging high-priority policy issues in science, in clinical medicine, and public health that are relevant to the goals of preventing and treating cancer, and to examine those issues through convening activities that promote discussion and potential opportunities for action. In light of this, the forum has followed through on a member recommendation from the committee to develop a workshop on cancer care in low-resource areas, cancer treatment, palliative care, and survivorship care. This forum is co-chaired by Drs. Robert Carlson, Dr. Richard Larson, and joined by the committee members that are shown on this slide. I'd like to take a moment and acknowledge the wonderful support that the National Cancer Policy Forum receives from our sponsors. At this time, I'd like to introduce co-chairman Richard Larson from the University of Chicago and representing the American Society of Hematology on the forum to introduce today's workshop. Dick.
Thank you, Mike. I'm Richard Larson from the University of Chicago. I'd like to add my welcome to everyone this morning. Together with Bob Carlson, my co-chair for this workshop, we'd particularly like to thank the Planning Committee for their terrific work in planning today's workshop. I'd like to give you a broad overview of the agenda for this workshop and put it into context with the forum's previous work. This is the second workshop in a two-workshop series focusing on cancer care in low-resource areas. The summary from the first workshop is available. It's in print now and available at the registration desk. It's also available online as a PDF file. The first workshop was held in October 2015 and focused on cancer prevention and early detection and was chaired by Greta Massetti and Kathleen Schmeller. Today's workshop focuses on the latter part of the cancer care continuum, diagnosis, treatment, survivorship, and end-of-life care, including the provision for palliative care throughout treatment. A major goal of this workshop is to consider low research areas, both domestic and international, and to understand whether there are lessons that may be transferable among these low resource areas. We hope that you will consider the topics today and share your perspectives about the opportunities to improve cancer treatment within low resource areas. The first day of the workshop includes 4 sessions. First, framing the challenge of cancer treatment in low resource areas. Next, understanding the diagnostic and multimodality treatment resources needed in these areas. Third, highlighting models and strategies to deliver cancer care. And finally, delivering comprehensive cancer care by integrating palliative care. The second day includes 3 sessions. The first will focus on cancer survivorship in low resource areas. This will be followed by our keynote session focusing on financing for global cancer care. And the last session will be a panel discussion that will highlight individual stakeholder recommendations for improving cancer treatment, palliative care, and survivorship care. My co-chair, Bob Carlson, will now introduce and moderate the first session.